Welcome back, my Be Health Empowered family. So happy to be back. We had like a 2-week hiatus, and so I am just delighted to be back here with you. My name, of course, is Dr. Melissa Clark, and I love when y'all call me Dr. Mel. You know, we here at Excuse Me Doctor here every week, making sure that you have the right information that you need to make the appropriate healthcare decisions for yourself, your family, and even your community. We are here to empower you with information. And so I just want to thank you for tuning in on whatever platform you're listening to us on, whether it's blackdoctor.org, whether it's Dr. Melissa Clark, whether you're on Sirius XM. And if you are newbies to the show, please hit that red subscribe button if you are listening on YouTube, or if you're listening on Facebook, give us a like. Really appreciate you for that. And thank you so much for tuning in. And, you know, like I said, we are here to empower you with information. We want to make sure that your questions get answered. So put those questions in the chat as we go through our topics tonight. Just go ahead and throw them in there. We are going to get to them first come, first served basis. So really would love if you, make sure that you get your questions answered. So now, let us go ahead and move on with creating an amazing week for ourselves with all the health topics we are going to cover tonight. And as you know, I have to have my road warriors with me when I do this. And of course, y'all know who those are: Wayne Bruce and Bria Good. How y'all doing?
What's going on, Dr. Mel? How you doing?
Long time no see.
I'm doing good. I'm doing good. How y'all doing? I know.
It's been like forever, man.
It does seem like a long time, but I'm glad y'all are back. I'm glad everybody's healthy. We are in a new year. We are ready to go.
Yeah, let's get into it. Tonight's show, you know, New Year's always bring resolutions, and people talking about they're going to get in the gym and
get some weight loss.
About they're going to lose weight. I mean, I started before the new year, so had a little head start.
You have some news to share, don't you? What you've lost.
I mean, what, my 30 pounds? I mean, is that news?
That is news.
Would somebody say I lost 30 pounds? I don't know if 30 pounds would be news. That the 30-pound weight loss on me would be news that I was working out and eating properly.
Yeah, and I gotta say, congratulations. You know, not like we said, weight loss. Not a lot of people can stick to their resolutions, and you actually started before the new year. So
because I knew I wouldn't stick to a New Year's resolution, so I had to get a jump start.
Well, that brings us to what we're talking about tonight, which is, you know, we have covered obesity on the show. We've talked about food as medicine. We've talked about nutrition. We've talked about exercise, but we have never talked about weight loss surgery as an option. And it's an effective option that's underutilized actually by African Americans. So we are going to get to the bottom of that. We're going to get all your questions answered. We have two wonderful guests, one an expert bariatric surgeon or weight loss surgeon, and the other someone who's going to share their weight loss journey because they have undergone a bariatric surgery procedure or weight loss surgery procedure. So it's going to be a great show, y'all. So just tune in, keep watching. Oh, okay, I'm gonna get it out.
Keep listening.
Keep watching.
Where's the heart?
And share it with everybody who you know who might have questions about getting weight loss surgery.
Right.
So there you go.
So there we go. So now we have to move into what's been happening in health and wellness since we've been gone. Ready?
Yeah.
Let's get it.
Recap.
Here we go.
So we always start with COVID, flu, RSV, every respiratory infection disease there is. It's a triple demic. So what's the new update with that?
It's over. The triple demic is over. We're actually on the downside, way down on a number of cases, new cases of RSV, new cases of flu in the wastewater, all that, those numbers are down.
Wow.
So that's good from an RSV and flu perspective.
Oh,
Mhm.
but God, that's crazy. Never would have thought
Yeah.
that.
Come on, come on, come
Yeah.
on. That's
And
party time.
Well, I don't know about all that. I mean, you still should practice good hand hygiene, good sneezing and cough hygiene, sneezing into a tissue or into your elbow, not take unnecessary
Please.
risks. But yeah, but we
I
Please
are
feel
way,
like
into a
way
tissue.
down from where we were in mid-December.
Please don't
COVID has
sneeze in
changed us
anybody's
all.
face.
If y'all not sneezing in your arms, wiping your hands, something's wrong. Like we need
Something
to
is
talk.
wrong with you
You're
after 10
nasty.
years.
You're
I wouldn't,
nasty.
I wouldn't go
And I
that far,
question your upbringing.
Okay, you don't become people character now. They're households. Don't come for that.
right, exactly. So now COVID in the wastewater, because you can't really go by the cases anymore. You got to follow what's happening in the wastewater in your community, because the wastewater doesn't lie. And even those numbers are actually down nationally for COVID. But we're still at about 33,000 people in the hospital with COVID right now. 1,200 of them are children.
Oh no.
Um, yeah. And there was a rise in the number of deaths from COVID to about 4,000, between 3,700 and 4,000 per day in mid to late January. So
Oh wow.
again, COVID hasn't gone. It's down from where we were in December, but it's definitely not gone. So continue to get your booster if you haven't gotten it. And I am continuing to mask indoors. I'm probably the only one, but I still do it.
No, I mean, I've seen people mask indoors.
Yeah,
Mhm.
that's
I
true. That's
mask.
true.
I mean,
Not in it, but it varies regionally. I mean, in
Oh, it
Maryland,
does.
where I am, that's the case. But there are other states, Florida,
Georgia.
that
Georgia,
Georgia,
you said
right?
Florida, Georgia, the Florida, Georgia line.
The twins.
Right,
Tweedledee
exactly.
and Tweedledum.
Nobody's masking down in Georgia, huh?
I mean, I went to the gym and saw maybe like one or two people with masks, but generally it's just not the custom.
Yeah. So that's that update. What's next?
So, it's been an emotional couple of weeks for us, for me, and for our community in the just everywhere. I mean,
Mhm.
everybody has seen or heard of the video of Tyree getting getting
Getting murdered.
killed,
Yeah.
getting murdered,
Yeah. Let's keep
being
it black and
murdered
white.
by the police, and it's heart-wrenching. And I know a lot of my friends. I tried to watch the video, I couldn't get through it.
Mhm.
I just couldn't get through it. As a black man, it's a tough watch, and I'm an older black man now, and seeing a young brother like that at the beginning of his life,
Mhm.
just I can't watch all of it. I can't. And I know some of my friends who watched all 60 minutes of
Yeah.
it or seen it.
Well, I want to talk about social stress and the immune system, because like you said, some people feel duty bound to watch it. Um, and whatever your motivation is or your ability to stomach the whole thing, prepare to experience the effects of stress on your body. You'll have an increase in stress hormones that prepare your body for that fight or flight reaction. But realize that every time you go into that mode, it takes energy away from your immune system, whose job it is to repair the damage from wear and tear on your body every day, from the toxins you're exposed to, etc. Um, and its job is to also protect you from infection. So high stress over time, continued high stress, ages us and makes us prone to chronic diseases. So if you watched or you plan to watch it and plan to continue to watch the videos, which I know this is not going to be the last of, unfortunately, make sure that you have a stress relieving plan, whether it be talking with your friends, being active in your community, exercising, doing yoga, having some kind of self-care activity, meditation, whatever it is. Make sure you have something planned to help decrease those stress levels, because they are toxic and they'll take a toll on your body over time. One of the ways that I dealt with the stress of watching the repeated police brutality videos is I actually did a TED talk on Black Lives Matter in the hospital and in the street, talking about what healthcare and policing have in common. Check it out. It's on, you can Google it. But it's one way to, it's a solution-based approach to what we go through. And for me, that was therapeutic to try to think about solutions. But the bottom line is, at this point, we don't have to watch the video to know that police reform is needed in this country.
Yep.
Mm-hmm.
We don't.
Yes,
Sad.
re-traumatizing for a lot of folk.
Yes.
But please take care of yourself, first of all. But on a different note, let's talk a little bit about dense breast and breast cancer risk. What's the correlation between those two?
Well, women with extremely dense breasts, that means they have a lot of glands in their mammary glands, the milk glands in their breasts, and not a lot of fatty tissue. They have an increased risk of breast cancer, anywhere from 4 to 6 times above the average woman. And that's actually even greater than the risk that a family history of breast cancer puts you at.
Oh, wow.
Yeah.
So wait, don't most women, when they take their mammograms, doesn't it show that they have dense breasts? Is it common?
It's common. It's about 1 in 10 women have dense breasts. It's more common in younger women, and there's some studies that show that it's more common in Black women. So yeah, you might encounter a lot of women who have said, they've been told, oh, you have dense breasts. It was difficult to actually read your mammogram as a result.
So what puts them at a higher risk, per se?
So it's the difficulty in reading the mammogram, but also it's thought that glandular tissue might be more prone to developing cancer. So if you get this report that, it was hard to read your mammogram, the next step often is either to get an ultrasound or an MRI. The MRI has to be approved by your insurance company. But that's next step in evaluating whether, anything that's whatever the mammogram showed was actually cancer or not. The FDA may approve a proposal this year that requires providers to tell women about their breast density. Right now, it's not required. And so it's really important to make sure you ask your provider if your mammogram shows that you have dense breast tissue. And in general, all women should be lowering their breast cancer risk by regular exercise, plant-rich eating, and decreasing your alcohol intake.
That's good notes. Good notes.
Yep.
Decreasing your alcohol intake.
Yes, a lot of women don't realize that alcohol is correlated with breast cancer risk.
Right.
Alcohol does everything, y'all.
Right.
Yes, it
So
does.
in the new year, I mean, that could be part of someone's New Year's resolutions. But I know a lot of New Year's resolutions. People are back at the gym, and some people are quitting caffeine or quitting coffee. Should we be quitting coffee, Doc?
Well, if you're doing it because of heartburn, anxiety, problems sleeping, or you're pregnant or breastfeeding, yeah, it's probably a good idea.
Oh.
But there are a bunch of new studies that are showing that coffee drinking might actually have health benefits, like protecting against Parkinson's disease, type 2 diabetes, liver disease, heart attack, stroke. And, these are correlations. So it shows that people who drink coffee tend to have lower risks of these conditions. And the reason why these newer studies are showing this positive benefit is because older studies didn't subtract out people who smoke and drank coffee together, right? But these newer studies actually did that, and they might be showing that your coffee habit, might not be a bad thing. Might be something you want to keep on with.
That's good to know, because I drink coffee every morning.
So now, is it like black coffee, or is it coffee with a lot of cream and sugar? Because that ain't
no,
real
black,
coffee.
No, black coffee.
Oh,
Black
No
coffee,
sugar, no cream.
No cream.
I like a little cream.
Well, she a little young, D. She don't know the song.
Yeah.
It was
You
actually
don't know a heavy D. It's a heavy D song.
I mean,
I know. I'm not that uncultured.
it's not a culture. It's just, I'm sorry.
Don't take my black
older.
card away, please.
Not going to take it away.
We're not gonna do that.
We know who you are.
Right. But
So,
what time is it now?
it is time.
The weekly debunk. Stopping misinformation in its tracks.
So this week I got a text from an old head, Tony, Twitter finger. Tony,
Wow.
Tyrone's older brother. We haven't heard from him in a while. He said, I told y'all, let me read the text because I'm going to look up in a way. I told y'all that vaccine wasn't safe. Didn't y'all see where my man Damar Hamlin died on the field because of the COVID vaccine?
I don't know about that one. Excuse me, Dr. Mel, is that correct?
Well, for y'all who don't know, Mr. Hamlin is a football player for the Buffalo Bills whose heart stopped after he was tackled last Monday night, actually a few Monday nights ago. He was successfully revived. He's now out of the hospital doing better. And that is absolutely not true about the COVID vaccine causing him to have a heart attack and die on the field. There's a lot of speculation as to why it happened. We actually did a whole episode on it. Actually, our last episode was on it. But Tony is probably referring to this fake headline that was attributed to CNN, published on January 11th, which was incorrect. But the headline said, the doctor of Damar Hamlin confirms cardiac arrest was due to the fourth booster vaccine. It was a doctored headline. It was not put out by CNN, and it was fake. So what are the real facts, right? Nearly 95% of the roughly 1,700 NFL players are fully vaccinated against COVID. None of them have had sudden death on the field. One cause of sudden death in athletes is heart inflammation, officially called myocarditis, which is known to happen after COVID vaccination in some young men. But the risk of that heart inflammation is actually 7 times higher if you've had COVID. And finally, there is no evidence that Mr. Hamlin had any heart damage from anything. So if you look back at that last episode, we had this great emergency medicine physician and sports medicine doctor, Dr. Chris Conti, explain the mechanism of how it happened. Go back and watch the episode. It's a really great episode. Talks about that, talks about CPR. But bottom line is this was not COVID vaccine related.
All right. Well, there you have it.
Yep.
Well,
Tony,
Bria and Wayne, thank you as always for walking us through the debunk and the recap. And we will see you back in a little bit, but we are now going to move on to the segment of our show having to do with weight loss surgery, which I know a lot of y'all are just hanging on the edge of your seat to hear. If you have any questions about bariatric, also called weight loss surgery, what it's like, what it's like to go through it, whether you qualify for it, this is the episode for you. And our two guests tonight, first of all, Dr. Tuesday Cook. She's a trained and board-certified advanced laparoscopic and bariatric surgeon, as well as a board-certified obesity medicine specialist. She's performed all kinds of weight loss surgeries, lap bands, vertical sleeves, Roux-en-Y gastric bypass procedures. You might have heard those names before. She's been doing it for 15 years. She lectures other physicians on how to do it and has written several journal articles and a book chapter about bariatric surgery. Welcome, Dr. Cook. I am so pleased that you're here.
Thank you for having me, Dr. Mel.
Absolutely. And then, as if Dr. Cook wasn't enough, we have Miss Annisha Tanksley. Miss Annisha Tanksley. She's a mortgage loan officer who shares her 155-pound weight loss journey with her thousands of followers on Instagram. She's going to give us the inside view on what it's like to undergo a weight loss procedure. All right. Hi, Miss Tanksley. How are you? I think we're not hearing you wonderfully.
Okay.
There we go. There we go. All right. Because
Can you hear me better now?
Yeah, now there we are. I can hear you great now. And I'd love to actually start off with you. Could you tell us about what your life was like before you decided to undergo weight loss surgery and what made you decide to undergo weight loss surgery?
So before I decided to do weight loss surgery, I was one of those ones that always had a New Year's resolution, right? I was always trying to, lose weight at the beginning of the year, and it was always a yo-yo. And by the end of the year, I put that weight back on plus some. And I went through that for years, trying different medications, just different ways to try to lose weight. I went vegan. I lost a lot of weight going vegan, but I didn't sustain with that. So I was looking for some different options out there. And of course, in our community, we don't hear a lot of people talking about the positive of having weight loss surgery and having that as an option. And so I started doing some research, and I started watching some other people journeys with weight loss surgery and how they were getting the weight off, and then their quality of life was changing. And so I started inquiring with doctors. Yes, the first step was to try to figure out if my insurance would cover it, which they did not. But there are some options here in the United States where you don't have to go out of country to get weight loss surgery, where it will be, very affordable. And so I did that, and it was a very fast process.
So let me ask you a question. What are the options if insurance doesn't cover it?
So I went to a center in Las Vegas called Blossom Bariatrics, and they do what's called a fast track program. So from the time that I called to inquire about it was to the time of surgery was about 6 weeks total. They will take your insurance to see what they can build as out-of-pocket network. And then they would do all those procedures on that. And then they would let you know what your actual out-of-pocket cost is.
I see. Okay. And so what were some of the challenges? Were there any requirements that you had to meet outside of insurance to qualify for the weight loss surgery?
So with the program that I was with at the time, their BMI, their lowest BMI was 31. So they wanted you to be at least over 31 BMI, but they have since changed that. And that was in June of 2021 when I had that surgery. Now it's 27, which is amazing because it's so many people out there that are struggling with, getting the weight off and keeping it off. But I didn't really have any particular things that I had to do. It's just once I got there for my actual surgery, we had some things lined up. So I had to do like stress tests and things of that nature.
Okay. Well, I'm going to go to Dr. Cook next before we hear about your after results from surgery. And Dr. Cook, can you tell us what is bariatric surgery? Are there different types? Can you kind of go into that for us?
Absolutely. So bariatric surgery is and technically we call it metabolic and bariatric surgery because we know that it changes your hormonal production and how your body responds to the hormones that you have. So metabolic and bariatric surgery is surgery that changes your anatomy to affect long-term and sustained weight loss. And we know that bariatric surgery really is the only way to have sustained weight loss for people who have severe obesity. And we say people who have severe obesity and not people who are obese, and not people who are overweight, but have obesity and have overweight, because we know that in 2012, the American Medical Association recognized obesity as a medical problem. We know it's a complex medical problem that has so many components to it. And I'm sure we'll get to that in a bit, but metabolic and bariatric surgery helps to affect the change in the amount of adipose tissue, adipocytes that a patient has. And in doing that, it changes their hormonal makeup and the endocrine and medical comorbidities that go along with them having that high weight of that severe obesity.
Right. And so when you talk about adipose tissue, you're talking about fat tissue, right?
Yes.
And so you mentioned that obesity is a medical condition, right? How does that relate to the struggles that people have? Like we heard from Anisha talking about how she was yo-yoing up and down before the surgery.
Absolutely. And so when people think about obesity, they just think, oh, that person is fat. So, we don't say that. We say that they have a high weight or a high BMI, body mass index. They have a high ratio of weight to the height that they are. And so we know that obesity is a chronic, progressive, relapsing, multifactorial neurobehavioral disease where an increase in the body fat promotes adipose tissue dysfunction. We know that adipose tissue is an endocrine cell, abnormal fat mass, physical forces, and it results in adverse metabolic, biomechanical, and psychosocial health consequences. And so having this high weight, having this high proportion of adipose cells to all your other cells leads you to have these endocrine or metabolic changes that then cause you to have things like high blood pressure and other cardiovascular disease. Type 2 diabetes is a big one, especially in our community. Obstructive sleep apnea, high cholesterol, dyslipidemia, we call it, osteoarthritis, infertility, multiple cancers is associated with. And so those are the ways that we are affected. And actually, Black people, Indigenous people, and people of color are affected disproportionately when it comes to having high adipose tissue or having obesity, as well as developing these comorbid illnesses. And again, remember I said it was multifactorial. There are so many other things that lead us to have these problems. And when you add obesity, it just confounds the problem.
Sure. We know cultural factors, lack of living in food deserts, poor nutrition, etc.
Epigenetic factors.
And, yes, trauma. Like, absolutely. Yeah, more trauma and higher rates of trauma, like we were just talking about, right? And watching violent videos.
Absolutely.
So what are the benefits of bariatric surgery compared to other methods of treating obesity?
So it's a great question. There are several methods that people have tried in order to lose weight and keep it off. And so one way is to try diet and exercise. We know that, diet and exercise are an important thing for us to maintain our health. But diet and exercise for patients who have severe obesity or who have overweight, it doesn't affect long-term and sustained weight loss, right? So that diet and exercise really is a behavioral lifestyle intervention, and it includes implementation of nutrition and physical activity, decreased sedentary time with behavioral treatment therapies. And so, we know that if they, keep frequent visits with their doctors, like every 4 to 6 weeks, and they, they try to exercise regularly, that it has some effect. I will say that there are decreased efficacy in racial and ethnic minorities when it comes to just diet and exercise. It's more important for us to have prevention. There's a bigger role for prevention than for trying to act after the fact. There are, for both Black, Indigenous, people of color, and for people who are white people, there's minimal statistically significant differences in behavioral changes. So diet and exercise doesn't work very well long term for either, especially when we have programs that are catered to people who are Black or people of color. And we don't have enough research to go into that long-term research to go into just diet and change exercise, but it doesn't cause, we already know, and it just like our mortgage broker said, it doesn't lead to sustained weight loss. It leads to kind of this losing 10 pounds, gaining 15, losing 15 pounds, gaining 20. And over time, it becomes harder to lose the weight and keep the weight off, even doing the same thing, the same dietary changes, the same exercise. Then we have pharmacotherapy. And pharmacotherapy, there are medications that we've been using forever, like bupropion, along with naltrexone, or phentermine and topiramate. And these are some combinations that we've used over decades that are not expensive. They're not, they're not trademarked anymore. And some of those things work a bit. There are newer drugs like the semaglutides, Wegovy, Mounjaro, Ozempic. Some of those things work as well. They're better.
Some of those are diabetes drugs too that people might have heard about on all the diabetes commercials on TV, right?
The type 2 diabetic who also has high weight, and we found that it worked pretty well for people who had high weight as well. But it has to be an understanding that you have to be on these drugs for life. These medications are for life. They're not something you're just going to take now and then stop and then, oh, look, I've lost weight. The weight regain will come. uncontrolled type 2 diabetes will come. And so we never ever X out the fact that pharmacotherapy can be helpful, but it's for the long term, for people who have, again, severe obesity, the pharmacotherapy doesn't work over the long term, especially for sustained weight loss. So when you're talking about things like losing 100 pounds to 150 pounds, that's when you want to start to think about metabolic surgery. Even people who have to lose only 50 pounds, metabolic surgery is what can help to lead to that sustained weight loss.
Yeah. So now, Anisha, I'd love to bring you back in. What results have you gotten from your weight loss surgery? And what type of weight loss surgery did you have?
So I had the gastric sleeve surgery, and the results have been amazing. Like, just as far as even just being able to tie my shoe. Now I'm able to not only walk, but I can run. I can go on roller coasters. I've gone zip lining. I've done so many different things that I have not been able to do in the past 10 to 12 years. Now, nothing's stopping me, and my quality of life is just so different now.
Right. What about, were you on medications before the surgery?
I was.
And are you still on those now?
No, nothing.
Okay.
Maybe a Tylenol here and there.
Yeah, yeah. Now, you mentioned gastric sleeve. Dr. Cook, can you tell us maybe 3 of the more popular procedures that there are available to have?
Absolutely. So one operation is called actually, I guess I'll start with the most popular. The most popular operation that we do in the United States now, and it's anywhere from 60 to probably 60 to 80% of the operations that we do now are the vertical sleeve gastrectomy. We do it laparoscopically, meaning we use long, thin instruments to do the operation. So you end up having very small incisions. And so what that does is it decreases the pain that you have perioperatively. You can leave the hospital the same day, the next day. Activities of daily living you can return to easily. You don't have a lot of adhesions in your abdomen. And so we do all of our operations laparoscopically. That's kind of generally what we do in the United States now. One operation, again, the one we do most frequently, is a vertical sleeve gastrectomy. And that's where we remove probably about 80% of the stomach. And to do that, we take about a bit of the fundus, the body, and the antrum. And so when we do that, we remove what are called chief cells, which are in the gastric antrum and the body and fundus of the stomach. We make a long, slender pouch that looks like a sleeve. And so it's called a sleeve gastrectomy. In doing that, we reduce the ghrelin hormone. We make changes to the gastrointestinal peptide, GLP-1, a glucagon-like peptide. We make changes to I'm not going to go through all of them because people
So a bunch of different hormones.
I'm excited about it. So we do hormonal changes.
A bunch of different hormones that
affect
and so
your
people
metabolism.
have
Portion sizes. They're not as hungry. They have early satiety, right? They make better choices because they're not as hungry. And then with the small portion size, decreased hunger, better satiety, and then the metabolic changes, they have the effect of the weight loss. So that's one. Another one is the room-wide gastric bypass, where we make a pouch from the stomach about the size of an egg, about a 30cc pouch. And then we reroute the small bowel to bring up a loop to that pouch, and we hook the bowel back together lower down. And in doing that, the patient again has good portion control, because remember I said that gastric pouch is about the size of an egg. They have less ghrelin, maybe not as much loss as with the sleeve, but still less ghrelin, but they have other metabolic changes that help with, again, weight loss and improvement of the insulin growth factor and insulin resistance. And so we have great improvement of resolution or remission of type 2 diabetes. People come off of their insulin pumps. They come off of their oral diabetes medications, their high blood pressure medications, etc. And that happens both with the sleeve and the bypass, but the data has shown that at 5 years, there's a tiny bit better improvement of the long-term remission of type 2 diabetes with the bypass. But the sleeve is going to bypass a run for its money because it does really good changes as well. And then
I think one of the famous, I just want to mention one of the famous people who had the gastric bypass is Al Roker, and we see how much weight he's lost and how he's kept it off over the years. But sorry, go ahead. You have a third one. Yeah.
No, it's great. There's so many people that have that, may or may not talk about it, but weight loss, it's a big deal in our community. And, only 1% of the population that that could access weight loss surgery even seeks it or seeks to talk about it. And the reason is there's so much weight bias and stigma. People don't want to talk about it with their primary care docs. Or, they come to me, they cry, because they want some help. They didn't know their diabetes could be controlled. They didn't know their hypertension could be controlled. Their high cholesterol could go away. But they're just scared
Almost
to seek it, or
miraculous.
they don't even know.
Yeah.
Right. And then, of course, there's the duodenal switch. And I mentioned that one a little bit more than I mentioned the band, because only about 6 or 7% of bariatric surgeons in the US are continuing to do adjustable gastric band. It's still something that's done. People still have it. They still have to be managed.
That's also called the lap band. I think people know it as a lap band.
Well, lap band is one kind. The adjustable gastric band, there were several kinds. And what it does is we put a silicone ring around the top part of the stomach and a port. I'm not sure what my port is, but there's a subcutaneous port we put in that we access it with a needle that doesn't leave a hole, and it makes it a little bit tighter or looser depending on what the patient needs. And so that it's not a bad operation. It's just there has been some weight recidivism increase with the adjustable gastric band. The duodenal switch is another operation that is not done by everyone and everywhere, but it's essentially a combination of the sleeve as well as rerouting of the small bowel to have the small bowel joint a little bit lower down and leave a common channel, or the part where the digestive enzymes meet the food, and you get absorption of the nutrients, vitamins, minerals, calories through that shorter portion of bowel.
Great. So, I don't want to make it seem like everything is rosy and perfect, although there are some miraculous stories and reversal of, like you said, diabetes and high blood pressure with weight loss surgery. So I want to find out, and metabolic and weight loss surgery, what can possibly go wrong? What are some of the things that could go wrong?
So great question again. So let's go by type of operation. For the sleeve, which remember I told you is the one that's most popularly done, it's one that we do the most in the United States, and actually it's increased around the world. With the sleeve, you can have things like leaking or bleeding, because when we have to cut and staple the stomach, sometimes suture, and so you can have leak or bleed. Like you could have anything. You could have a leak or bleed with your colon cancer surgery when we resect
Any kind of surgery,
or bleed, right, with your hysterectomy. But leak or bleed is one of the things that can happen in the range of anywhere from 2.4 to about 6%. Patients in the long term could have some heartburn because it's a high pressure system. Not everybody gets that, and a lot of people actually have resolution of their heartburn.
Yeah, the acid could go back up your
esophagus, back from the stomach, but there's not as much acid produced because remember we removed that fundus, body, and part of the antrum of the stomach, and so there's not much acid. But because it's a high pressure system, you can have some heartburn, and a lot of people get resolution of that with a PPI, or omeprazole, lansoprazole, pantoprazole. But I tell my patients that it's a possibility it can happen because we give lectures on that in our society. That what happens when you do that? Some people have to be converted to a bypass because the heartburn is so bad. And the bypass is a low pressure system. So those patients don't usually get heartburn, but the bypass itself has its own possible complications. So again, you can get leak or bleed. And again, you can get that with any operation, but you can have internal hernias where we cut the small bowel and put it back together. There's a little space, and that space could be closed. It could be left open, but sometimes bowel can twist under there and you can get an obstruction, meaning the bowel gets blocked off. And so we have to pull that bowel back out and close that space. Things like marginal ulcer. If you're a smoker, I won't operate. No bariatric surgery going to operate on you. You got to stop smoking if you want bariatric surgery. But if you're a smoker and you resume that after surgery, then you can get what's called a marginal ulcer. The stomach doesn't like the mucosa, that lining that protects your stomach doesn't like nicotine and smoking and decreasing oxygen levels, and so you can get an ulcer there that can perforate. You can have things like bowel obstructions, vitamin and mineral
nutrition? Yeah,
that's so vitamin and mineral deficiencies are something that can occur more with the bypass than with the sleeve. And that's why every patient I operate on, they know from the beginning. When you take the class at the beginning, you see the nutritionist, so of course you see the nutritionist, you see the exercise physiologist, we have behavioral health specialists, because we have to work through all these things go together to help use your surgery as a tool. But they know that they must take their multivitamin and their minerals and supplements daily to ensure that you're getting all the nutrients you need as a metabolic surgery patient.
Right. So now that was a wonderful rundown. So Annisha, what tips would you give to anybody considering weight loss surgery?
First and foremost, I would just say, if you're considering it, do your own research. Do not let anyone get in your head about the surgery, because there's so many positive stories out here and so many people that have had great success with the surgery, to compared to anything negative that they've heard. So do your own research. Other than that, be mentally prepared for it, because it is definitely a lifestyle change.
Hmm. And, I have so many more questions to ask you both, but I want to make sure that we get in some questions from the audience. So, Bria and Wayne, if you could join us, tell us what's going on in the chat, bring us the word from the street, and let us know if there are any questions for either Dr. Cook or for Anisha.
Bree, why don't you kick it off?
Sure. So this question is from Sharon Jones, and this actually applies to both of you. So, what is it like for someone post surgery? And we talked a lot about how weight loss surgery is a long term solution, right? But what does diet and exercise? How does that still apply after bariatric surgery, and how has it been for you, Anisha?
Why don't we start with Anisha and then go to Dr. Cook?
Okay, sure. So for me, definitely it's a restriction. So there's portion control automatically. And I try to do everything I can to be successful with this surgery. So if my surgeon said to eat your protein first, I'm going to eat my protein first, right? I'm trying to get as much of the protein in daily as I can before I put anything else in my body. Exercise. When I first started out, I was scared to go to the gym. I didn't go to the gym, but I said, you know what? I'm gonna get out here in my neighborhood and I'm gonna walk these hills. And so I did that for 5 to 6 days a week, sometimes every day throughout the week. I would just walk.
Wonderful.
And the more I walked, the more I stayed on my program with that my surgeon, my nutritionist gave me, the more the weight came off. And I just started to feel amazing. And then after walking, I was able to start running.
Wow.
That's awesome.
Yeah, you are truly a success story. That's beautiful. Dr. Cook, what do you have to add?
So I would say a couple of things. The first one is I tell my patients from the beginning, I could cut you from the rooter to the tutor, but if you don't do the things that go along with your tool, it's not going to work. And so, I say, yes, you'll have improved portion control. Yes, you won't be hungry. But if you decide that when you're going to eat, you're going to have a sugar-based meal, a gummy bear will always knock me out, right? Coca-Cola is going to slip right on down. Nothing I can do is going to change those things. And so you're doing your protein first, portion out your meal, protein, and then your plant-based carb. Things like you're now allergic to rice, pastas, cereal, mashed potato. You're allergic to those things. Now, will you be able to maybe eat a little bit later on? Maybe we could talk about it when we get there. But, the maximum weight loss happens from 12 to 18 months. And so we want to use that time and use this tool as much as we can to get as low as we can, so that when you say, okay, I lost 150 pounds, but I gained back 20, nobody cares, right? You lost 150 pounds, you lost 130 pounds. And so your knees don't hurt. Yes, you can walk more. Yes, you can run more, right? It's important. Taking your vitamins. And I also caution my patients that, a lot of people see me for infertility because of PCOS. And they're like, oh, I can't get pregnant, Dr. Cook, don't worry. And I say, please, we want you to get pregnant for 12 to 18 months. And I get invited to a whole bunch of baby showers because people who didn't think they could get pregnant, and we have lots of studies that show this, it improves your fertility. And so, I had a couple people come to me with twins. Please.
That's beautiful.
Lose your weight. It happened, but diet, exercise, got to have it along with surgery. Follow up with your surgeon, follow up with your nutritionist. Nothing works without you being a part of that behavior modification that goes along with using the tool.
Okay.
All right.
So we have another question coming from Maria Sindos. It's for Dr. Cook. Could you speak of drug and alcohol abuse after gastric bypass surgery in people who were previously never been substance abusers?
So that's an excellent question. Was that Maria?
Yes.
There are studies that demonstrate that once some people, it's not the vast majority. There's a small subset, but there are a percentage of patients who have a bit of transference. And what that means is that they sometimes used food as not just nutrition, but also what we call emotionally eat. They use food as a reason for dealing with loneliness, a reason for dealing with sadness, a reason for dealing with anxiety, especially during the pandemic. This was a big one during the pandemic. People ate for comfort. And there's a reason why comfort food is called comfort food. You in Georgia, Bria, you know. Comfort food is high carb food, high fat food, high greasy food. And so they were now unable to use food as the treatment for what was ailing them. And so they turn to other things that are easier to do. Some people turn to sex. Some people turn to shopping and losing a lot of money, or gambling. Some people turn to drugs, alcohol, smoking. All these things can develop in a post-op patient. Can develop in anybody who has the use of one thing and has to trade it in for another. Yes, but we have studies that have demonstrated that when people can no longer eat for comfort, they choose other things.
So it seems like,
and I would mention, please, if that has happened, if you know someone who has this, they should follow up with their nutritionist, their surgeon, as well as their behavioral therapist. The person that met with them before and cleared them for their surgery, they should follow up with them. And if they don't deal with that, they can direct them to a resource that can help them with the addictions that they're dealing with.
excellent points. And I just wanted to mention the importance. I don't know if it had really been brought out in the pre-op preparation for metabolic and weight loss surgery, the importance of a behavioral health evaluation, counseling, etc., to prepare you for what life is like and the changes that you have to make post-operatively after the operation.
Absolutely. Yeah. It's of the utmost importance. And I want to make sure that I make it clear that we do not use mental health clearance as a barrier to weight loss surgery. I, in fact, am opposed to someone saying, no, this person has schizophrenia, and our society is opposed to it. What we want is to make sure that people don't have little things that we can tease and parse out to help treat before your tool is made. You want to make sure that you can take care of yourself in the perioperative period. And in the long term, do you have a therapist that's going to follow you? You've had suicidal ideations or attempts in the past. We want somebody that you're in already with a therapist that's going to follow you as you lose weight. Some people can't deal with the getting attention. They've lost 100 pounds. They look different. Now more eyes are on them. Hey, you look different. You look great. What's going on? And, it's hard for them to deal with those things. So a history of schizophrenia, suicide ideation, clinical depression, those things are not things that deter you from weight loss surgery, but they're things that we want to help deal with. To go along with, again, you being safe and having good outcomes after your weight loss surgery.
Excellent. Excellent. What else do we have in the chat?
Yeah, so this question is for Annisha. You had mentioned that you had one of the tips that you had given everyone was to do their own research, see if it's good for them, all those things. But ever since you got your surgery, has any of your family or friends had a piqued interest in it? Have they gone out and got a weight loss surgery as well?
So I have a pretty decent following on TikTok. My following on Instagram is growing as well. I talk to people on a daily basis about the surgery, that I've inspired to go ahead and have the surgery, to not worry about what other people, say. They just went and did their own research and went for it. As far as my family, they have not. I don't have anyone that it was going to have the surgery, but everybody's on my diet in my house.
That's good.
Oh, that's great.
Oh, that's good.
Everybody's on no sugar, high protein, low carbs.
So you are being a light and an inspiration to countless others, including the ones in your inner circle.
Oh,
That's
yes,
awesome.
absolutely.
That's beautiful.
Absolutely.
Okay.
I take calls, I take messages, texts, emails, whatever. If I can help someone else improve their quality of life, like I did my own.
Wow.
Why not?
Wow.
That's beautiful.
So got a couple more questions we got to get in on lightning round here. What is the average cost out of pocket for weight loss surgery?
I don't know what the average cost.
Dr. Cook, can you take that one?
She paid cash. She can tell you. Annisha paid cash.
Let's go. I don't know if she wants to discuss it.
It's no big deal. So I paid $6,500 out of pocket for mine. And everything else was built out of pocket network for my insurance company. So that's how the center did it that I went to. But there are numerous options out here. And I will say, a lot of insurance companies now are covering bariatric surgery. Like
I would
call
say the
your
majority.
insurance company because they are covering it.
Many,
Yeah,
good.
the
many are
majority.
covering it. Can I tell you, it's covered by Medicare. Medicare covers weight loss surgery. Maryland Medicaid covers weight loss surgery. I'm in Maryland, so that's why I say that. But I have people come from New York. I have people come from Nigeria. In any case, it's covered. So make sure you talk to your insurance company. They might try it, but don't let them try it. Don't let them get you. They don't want to pay. Can I tell you that 25% of weight loss surgery patients get denied 4 times before they're approved, and nothing changes. And about 60% of those patients report a worsening of their medical problems during the time that they're waiting to get approved.
Wow.
And so that's why we lobby on Capitol Hill, and we lobby in Annapolis. Well, that's the capital of Maryland. And we lobby to make sure that these things are not happening. It's not right for insurance companies to be able to tell you, no, you can't have the thing that's going to save your life, or you need to be sicker in order to have the surgery that's going to make you better. Makes no sense. I do a lot of peer-to-peers talking to the doctors, and insurance companies tell them absolutely not. But what I will say is it really does vary cost from state to state. Make sure you have the benefit. And if you don't have the benefit, you can switch your insurance and get the benefit.
Absolutely.
And let them pay for it. You pay a premium.
Great point. Great
Make
point.
them pay for it.
Absolutely.
So
And let me just say this: $6,500 sounds like a lot, and it is a lot. But compared to what you have experienced in terms of the quality of life that you have achieved as a result, I'm sure you think it's worth every penny of it, right?
Right.
I would pay it 10 times over.
Yeah,
Bria,
exactly.
Bria, we got 1 minute. What's your question?
My last question is, if Black people are underrepresented when it comes to the surgery, what race and ethnicity do we normally see access this type of surgery?
And if I could piggyback onto that, what could we do to let more Black people know about the option?
Excellent question. Excellent question. So we know that 42% of people in the U.S. have obesity, and non-Hispanic Black adults are the most affected by it. We have the highest prevalence of obesity by 49.6%, and most of us, more than 60% or 64% are women. So Black women, then Black men, then Hispanic adults at 45% thereabouts, and then non-Hispanic white adults by about 42%, right? And then Asian adults, American Asian adults, about 17%. And so, we are represented in terms of the number of patients having obesity, but not as much in the ones that are having access to or seeking access to or knowing about weight loss surgery. And so I would say, tell a friend. Most of my patients come from people I've operated on. I've done a lot of wives and husbands, right? I've done a lot of wives and wives, husband and husbands. People, I did a grandmother, then I did her grandson, then I did her daughter, and then her niece is seeing me now. So, somebody asked Annisha, hey, your family doing it now? The families, husbands and wives and family members, they come in droves once you are that example for them. Once they see that you're doing well. Some people are scared. They don't know that weight loss surgery is as safe as gallbladder surgery, an appendectomy, knee surgery. It's as safe, if not safer than those. And we do those.
And it's approved for teens, right?
Absolutely. I did an 18-year-old 2 weeks ago.
Yeah.
From Bowie, Maryland.
Wow. All right now. Well, you all have been just a wealth of information. Annisha, can you say what your TikTok and IG handle are so people can find you?
Yes, absolutely. So on TikTok, I am Annisha_Tanksley. Annisha_BSG_Tanksley0. And on Instagram, I have 2 handles. I am Annisha the Sleeve Queen and Annisha Tanksley.
All right. And Dr. Cook, if people want to, where do you work in terms of new patients?
Oh, sure. You can always contact me on Instagram at Tuesday Cook MD. I wish I was better at social media, but I'm not. I'm always in the operating room. So you can also just find me at Adventist Healthcare at Fort Washington Medical Center. And I kind of see patients all from everywhere, from Charles County all the way down Southern Maryland, all the way up to the north, Pennsylvania, other countries, Just reach
Well,
out to me. I do televisits. I see everybody.
all
But
right.
be ready because I don't play around.
Oh,
I'm
hey,
assuming
I think people are clear about that. Definitely. Thank you so much both for being here. And thank you, of course, to Wayne and Bria for being my fantastic co-hosts, bringing the questions in from the chat. Thank you, my Be Health Empowered family. I have to let you all know, of course, that there's that special research study. It's still going on at Howard University called the COVID Resilience Research Study. Just by listening to the show, you're eligible to participate. And if you just fill out 2 surveys to let the researchers know how you have coped during the pandemic, you're eligible to be reimbursed up to $100 just for filling out those 2 surveys. If you have any interest, reach out to Dana Harvey Research at gmail.com. You see it up there on the screen. DANA Dana Harvey HARVEY research at gmail.com. And now I really just want to express that this show wouldn't be what it was or is without a very special person who recently we have lost. And that is Mr. John David Wayne Robinson. He's my father-in-law, a wonderful person. And, you know, I often say, anybody who's heard me speak, I've said the phrase, the last time the dinosaurs met, they voted not to change. I get booked to speak across the country. And anytime I talk about health and wellness, I talk about the need to embrace change. And my father-in-law, I call him Big Wayne. Every time I mention that, I talk about him because he embraced change with all the health challenges that he had. When I met him 20 years ago, he quit smoking. He had a drug and alcohol addiction. He was able to overcome that. He had type 2 diabetes. He lost weight, over 100 pounds by changing his diet and his lifestyle. And he taught me really what it was like to embrace change and not run away from it, because the last time the dinosaurs met, they voted not to change. And he was able to add years to his life because of what he did. And through what his example, I was able to inspire others and talk about all the wonderful things that he was able to do in his life. He gave me permission to talk about his health challenges to inspire others. And, you know, I talk about him because he really, embody that quality of embracing change and also being a fighter. He also, you know, fought and advocated for himself in the healthcare system, which is what we really want to inspire you to do, to be a fighter when it comes to your health, the health of your family, the health of your community, and your own personal health. So he embraced the ultimate change, death, this month, January 4th. He did it on his terms. He let us know that he was going to transition. We didn't know when, but it was within 3 days of him letting us know that. He did it joyfully. He was like a kid going to Disneyland. He was so excited because he was ready for that transition. And so it's made it easier for us to rejoice in a life well lived. And I just want to thank you, Big Wayne, for teaching me so much so that I could teach others. So signing off, thank you so much, my Be Health Empowered family. Thanks for all the great questions you asked tonight. And until I see you next time, remember, be wise, be well, and be health empowered. Thanks for joining.
So I guess I should thank the Robinsons. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.